Chronic obstructive pulmonary disease, or COPD, is one of the top 3 causes of death worldwide. Every year, it claims around 3 million lives. Yet it is preventable and treatable if diagnosed. However, it remains substantially underdiagnosed and therefore under or mistreated. An estimated 300 to 400 million people live with COPD, leading to years lived with disability, high rates of hospitalization, and a high economic burden, particularly in low and middle-income countries. This burden is expected to rise further as populations age and risk factors persist. The main environmental factors leading to COPD are tobacco smoke and exposure to household and outdoor air pollution. Where tobacco smoke is the cause, smoking cessation is a key intervention. When available, referral to a comprehensive cessation program should be offered. See our desktop helper on Very Brief Advice to learn more. Non-smoking risk factors may be more important in low and middle-income countries, contributing to over 50% of the global burden of COPD. Wood, animal and crop residues, and coal, typically burned in open fires or poorly functioning stoves, may lead to very high levels of air pollution. Household air pollution affects almost 3 billion people globally. Where possible, switching to cleaner fuels, such as gas or electricity, can lower the risk of COPD and other respiratory diseases. Occupational exposures such as crop burning, grain, flour and tobacco dusts, vapors, fumes and chemicals play a critical role, particularly in construction, mining, agriculture, and are important yet underappreciated risk factors, especially in unregulated environments. Advocacy to reduce workplace exposure remains a key strategy for COPD prevention. Air traffic pollution can also expose people to hazardous levels of PM₂.₅, fine inhalable particles smaller than 2.5 micrometers. Finding alternative walking, cycling, moped or driving routes off the main roads may reduce exposure. Personal factors include early life disadvantage, such as childhood respiratory infections, malnutrition, and second-hand smoke exposure. While rare, the most relevant genetic risk factors for COPD are mutations leading to alpha-1 antitrypsin deficiency. Finally, climate change is adding new challenges. Extreme heat, cold, wildfires, and dust storms have been linked to excess mortality and more frequent exacerbations among people living with COPD. Your key message: identify and reduce exposures. Consistent, supportive cessation advice combined with practical measures to address indoor and outdoor air pollution, occupational hazards, and temperature extremes can make a meaningful difference for patients and communities. Furthermore, early detection, vaccination against respiratory infections, and patient education further enhance tertiary prevention and improve outcomes. Now, time to solve a short quiz to reinforce your learning. A set of selected IPCRG resources will be available for you at the end of this breath.